Maybe you're thinking of dropping one or more of the insurance plans you have in your practice. Well, which one should you drop? And what would happen if you drop it? We're going to talk about that and more in this week's tip. A fee-for-service private practice, is that even possible in 2021? Now, I know that it is. But if you were to ask the average dentist, a majority of them would tell you it is not. You're going to have some degree of participation in plans. Many will tell you that, well, if I drop this plan, my practice would go bankrupt. I couldn't afford to drop this plan. Well, a funny thing happened in 2020. In 2020, many of you and many of our clients were sitting at home, were at the office once in a while delivering emergency care, and noticed that these plans that they couldn't live without, that they were doing $680 crowns for when their full fee was $1,400, these plans they couldn't live without, all of a sudden weren't really doing all that much for them. So many doctors started to look at the idea of what would happen if I dropped these plans, or at least some of the plans, maybe the lower reimbursing plans. Now with MGE clients, they have a tendency to drop the lower reimbursing plans, or they go completely fee-for-service. There's a gradient scale. So what we did, this was back in 2020, is we created something called the Plan Analyzer. It's a spreadsheet. And what it does is the Plan Analyzer tells you a few things. You basically are analyzing a particular insurance plan in your practice. It tells you, one, how much you're actually losing by participating in this plan, and two, how many patients could you afford to lose if you were to drop the plan? Because one thing we've also found is that the average drop rate, if you drop a plan, the average patient attrition rate is about 30%. In other words, if you have 1,000 patients in a plan and you decide no longer to participate, the average doctor is going to lose about 30% of those patients. Now, obviously, there's a right and a wrong way to do this, Couple points I'll make. One, if I were to start dropping plans, I would definitely want a good flow of fee-for-service new patients coming into the practice. And for that, we have services like the MGE New Patient Workshop, which you can find out more below. Also, if you're really looking at going this fee-for-service route, you're going to want to make sure your practice is organized, that you're excellent at case presentations, and that you have a really well-trained team who provides excellent customer service. And for things like that, we have the MGE Power Program. Again, I have a link below where you can find out more. But some offices have maybe just one plan, in which case this is an easy decision, or you might have others that have, 80% of the patients are involved in some kind of plan. So it's going to be a, sort of a gradient scale, drop this plan, that plan, maybe the worst one or the worst reimbursing or the one with the lowest amount of participation. So for that, we created this Plan Analyzer. And what I want to do in this video is I want to show you this Plan Analyzer. I'm going to show you the basic form so you can apply this to your practice and work out, whether you want to keep that plan or not and what impact it might have on your business. So we'll have a look at the screen. All right, so let's take a look at our filled out Plan Analyzer here. So we have section 1. The period we're evaluating in our example is 2020. We look at gross practice revenues. We say the practice collects about $75,000 a month. It collected $890,000 in 2020. And the plan we're evaluating is ABC plan. The plan patients we saw in 2020 are 550, and our gross revenue from the plan, including patient copayments, was $250,000. Now, this is not a cap plan. This is a PPO, so we did not get any cap checks. So now we're going to look at what is our average revenue per plan patient. It's $454.55. All right, now we're going to do our fee study. So we pulled 3 preventive procedures or diagnostic, 3 basic procedures, and 3 major procedures. All right? So let's take a look at how those shake out, what our actual fee is and our plan fee is, and that actually populates the rest of the form for us. So we'll put this back up on screen. All right, so the 3 preventive procedures we picked were a comprehensive oral exam, 4 bite wings, and a PAN. Here's our CDT codes, and then here's our full fee for these, and here's our plan fee in the plan fee schedule, and this calculates and gives us a write-off percentage. Then we pull 3 basic procedures, 2 composites, or a 2-surface and a 3-surface, molar endo. We have our full fee, on your fee schedule, and our plan fee. And then for major, we pulled a crown, an onlay, placing an implant. We have our full fee and our plan fee. And you'll notice it gives you a little write-off percentage for each procedure here. And then we get to the write-off percentage by category. Now, of course, this is extrapolated. You know, you'd have to enter all your fees in here. I mean, it would get a bit lunky. And remember, this is an estimate, but it's been pretty close. You know, it's been pretty close. I can never make any guarantees. There are no guarantees in life. But this gives you a little bit of insight into what's going on. So let's have a look at what you're writing off and how this all shakes out. We'll put this back up on screen. So your estimated diagnostic and preventive write-off is about 32.33. Basic write-off is almost 30%, and our major write-off is a little over 36%. So now we get our further study and breakdown. Now here, what we did is we took a look at the average dental practice. You know, we work with a lot of dentists, of course, and we looked at what is the average percentage of their revenues that's diagnostic and preventive, basic, and major. This is how we came up with the algorithm to spit out these calculations. Again, as I mentioned, is it perfect? No, because practices vary, but this is pretty close to average. So this gets interesting. So we'll put this back up on screen. So the estimated diagnostic and preventive revenue as a whole revenue of the practice is practiced at $890,000 is about $200. $56,000 was from the plan. At full fee, that should have been $83,000, so the practice lost $26,000, almost $27,000. We did the same thing with basic, and we did the same thing with major. So all in all, the practice lost last year. Again, let's look. The planned procedures they did, they got $250,000 for. At full fee, that would have been $375,000. So the practice lost $125,000. So now let's go to the full breakdown, and this is where it gets fascinating. This is where it gets fascinating because this is going to tell you, based upon how many patients I lose, how many fee-for-service patients do I need to replace the ones that I lose. This is where it gets fascinating. Let's have a look. Section 6, our analytics and estimates. So obviously we just went over this. The practice lost $125,000. Their average revenue per planned patient, which we covered earlier, is about $455. They have 550 planned patients. They entered this all in the beginning. So the number of fee-for-service patients they would need, people paying their normal fees, if they lost 100% of their planned patients, is 366. So that's fascinating point number one. If they lost all 550 of these patients, they'd only need 366 patients to replace them at that level of revenue. Now, one thing I should mention, I have yet to see in my career a practice lose 100% of the participating patients when they've dropped a plan. As I mentioned earlier, it runs about 30%. Okay, again, it could be better, you know, or it could be worse, depending on how you handle it. But it runs about 30%. So let's go back to this now. If you were to lose 75% of the patients, that's 412 of the 550 patients. You only need 229 patients at full fee to replace the revenue associated with those patients you lost. And it gets better when you get to 50%. In other words, if you lose 275 of these patients, we're at 91 patients needed. And if you lost the average number, which is about 30%, in this case, 30% would be 165 patients, 30% of 550. You'd actually, you'll notice this number is negative. You wouldn't need any patients at full fee to replace the patients that you lost. So what does this tell us? Let's just let this sink in, because I think in a lot of cases the reason why people freak out about this is they don't run the numbers. What this tells us is this example I'm giving you, this practice, these numbers are not off the wall. I've seen these types of numbers for fees before in plans. This tells you if you were to lose 30% of you, 550 patients in the plan, or 165 patients, you would need 0 patients, new patients, to replace the patients that you lost, and you would still make the same amount of revenue. Let that sink in again. So that means you're not working as much because there's 165 patients less. Yet the revenue is the same, but your costs will go down because there's less labor involved, there's less materials involved, there's less lab fees involved. Now, if you want to get really cool about it, you go get more fee-for-service new patients, and you start to expand. here's my point. I guess my point is this. You deserve to get paid your normal fee. All right, as a matter of fact, and we've talked about this at length before, when you bring reduced fee plans into the practice, you're effectively making your full fee, people paying full boat, patients subsidize the reduced fees you're getting on the plan. And in many cases, if you really run the numbers, there aren't a ton of reasons for you to continue to do it. Now, obviously, I can't speak to your individual situation. Every situation varies, and you have to move forward at your own pace and how you want to do this. And obviously, some practices have a lot more managed care than others. You might just have one plan, in which case you go, heck with it, I'm done with it. Another, you might have to do it, phase it over time. It is important to be able to drive more fee-for-service new patients into the practice, and for that I would recommend the MGE New Patient Workshop. No matter what you're doing, it's a smart move, especially if you're looking at dropping plans. And also, if you're going to run a fee-for-service practice or start to move in that direction, you're going to want to have great customer service. You're going to want to be dead on when it comes to presenting treatment and getting patients to accept. And you're going to want to be able to have an excellently trained staff team and be very well organized. For that, I would recommend the MGE Power Program. Look into it. I have links for both New Patient and the MGE Power Program, the New Patient Workshop, rather, and the MGE Power Program below. But look, I invite you to give this a try. Apply it to your individual plans. I'm happy to go over your feedback. If you have questions as you're going through this process, you can always email me at jeffb@mgeonline.com. I'd like to see how this rolls for you. It's definitely a little bit of an adventure, and it can be kind of fun. I wish you the best. Give it your best shot, and again, tell me how it goes. And if you want to find out more about MGE, check us out at www.mgeonline.com or give us a call at 800-640-1140. Take care.